Emergency health services are calling for reinforcements as Western New South Wales continues its battle against COVID-19. While daily numbers dipped across the region, authorities are far from relaxed, urging us not to be complacent.
They're the people responsible for keeping us safe from COVID-19. Now our frontline workers are calling for support as the health system struggles to keep up with the COVID-19 pandemic. There are now almost 1,000 people in hospital with the virus across the state, with nearly 200 in ICU. Outbreaks in hospitals have meant nurses are being forced into isolation, placing even more demand on the system. For regional health, the added pressure could soon become too much to bear.
Our members are really being pushed to the ends of their limits. Those that are working double shifts or lots of overtime. They're working short-staffed, so it puts additional pressures on those that are left.
29 new cases were diagnosed overnight in Western New South Wales, bringing the total number of active cases in the region to 630. Head of the Western Health District today conceding the region would need extra support, with the situation expected to worsen.
We know that in coming weeks and months that there's going to be some real challenges coming our way. We will need extra help in managing the demand, particularly in our hospitals in coming months. Despite
a drop in case numbers, hospitalisations across Western New South Wales climbed again overnight, with 18 people now receiving hospital care. 4 are in ICU and requiring around-the-clock supervision. Here at Orange Hospital, 4 cases of COVID-19 are currently receiving treatment for the Delta variant.
The anticipation of what's coming is what's making a lot of our members really concerned. Our members were already fatigued before this pandemic started. They were out there calling for increased staffing before this started. So they were coming in with a level of fatigue, and now this has been thrown on top of them.
The association is calling on the Ministry of Health to bolster the workforce before the situation becomes unmanageable. The local health district has begun seeking extra workforce support from Sydney, as well as recruiting retired nurses to assist in regional hospitals. Olivana Lathouris, WIN News.